Okay, my name is Kelly Lindsay. I will be talking about the unique health concerns for survivors of sexual violence. So a brief description on this population, or brief description on sexual assault, it can be defined as any unwanted sexual contact or attention resulting from force, threats, bribes, manipulation, pressure, or violence. It can take many forms, including rape or attempted rape, domestic and dating violence, and child sexual abuse. This also includes intimate partner violence. It can be non-physical, it could just be verbal. What is unique about this population is that anybody can be a target of sexual violence regardless of their age, gender, race, socioeconomic status, regardless of where they live or work. What is the size of this population? So underreporting of sexual assaults definitely creates an inaccurate representation. Victims underreport sexual assaults to law enforcement a lot. There's also varying requirements for law enforcement agencies to track and report this data. So what we do know is in the US, approximately 34% of rapes and assaults are not reported to law enforcement. And in Utah, only 23% of sexual assaults are reported to law enforcement, so that's really not very many. Of the information we do have, globally 35% of women have been a victim of sexual assault. Regions with the highest rates of intimate partner violence specifically are Africa, the Eastern Mediterranean, and Southeast Asia. And regions with the lower rates of intimate partner violence are the Western Pacific and European. Specifically in the United States, 1 in every 3 women will be a victim of sexual assault. 1 in every 3 female rape victims experienced it before the age of 18. Nearly 1 in every 4 men will be a victim of sexual assault, and almost 1 in 4 male rape victims experienced it before the age of 18. In Utah, 1 in 3 women will be a victim of sexual assault, and 1 in 8 will be a victim of rape. In Utah, the rape rate has been higher than the national rate for over 25 years. Sexual violence is the only violent crime in Utah that has higher rates than the nation for any violent crime. So that's not good. Some risk factors attributed to the increased rape rate in Utah include harmful gender norms, lack of nonviolent problem solving, harmful norms regarding sexual violence. In Grand County, where I live, the rate for rape is even higher than the Utah average. Social determinants of health. So while anybody can be a target for sexual violence regardless of their environment, there are still some social determinants that can impact survivors. For example, economic stability. So children living in poverty are more likely to be victims of sexual violence. Some associated factors between poverty and the high risk of sexual violence during childhood includes negative parenting, family stress, mental illness, material hardships, and irregular employment. Survivors of sexual violence can also have economic impacts due to medical expenses, having to take time off of work, those types of things. I also want to mention sexual violence perpetrators. So since anybody can be a target, I think it's important to point out some of the risk factors for sexual violence perpetration. So social and community context risk factors include poor parent-child relationships, interfamily conflicts, associations with delinquent peers, gang involvement, and also normalization of sexual violence within the community. There's also the economic stability risk factors for perpetration, which are poverty and lack of employment opportunities. Some specific concerns for survivors of sexual violence can be physical, psychological, and economic. So physical impacts would be from traumatic injuries, unwanted pregnancies, STIs. Psychological impacts can include personal safety problems, guilt, shame, anxiety, depression, suicidal tendencies, PTSD and eating disorders. Economic impacts after a sexual assault can be medical expenses, taking time off from work, losing employment, those types of things. The root causes of health concerns for these survivors can be traced back to the assault itself, which can result in many short and long-term physical and psychological injuries. So physical injuries due to trauma. There's also chronic reproductive, cardiovascular, GI, and sexual health problems for these patients. They can have headaches, chronic pain, difficulty sleeping, activity limitations, PTSD, depression, anxiety, eating disorders, and suicidality. And again, these can be both short and long-term problems. Maslow's hierarchy of needs for survivors of sexual assault, assuming that they weren't displaced from their home after the assault or they weren't homeless to begin with, it's assumed that their physiological needs are probably met. However, the next level, as far as safety, they probably have some concerns and unmet needs after the sexual violence, which then kind of disrupts all the other levels of the pyramid of needs. So their functional level, so survivors are probably maintaining their basic survival needs, but struggling to secure their sense of safety and security. After they meet this need, then they can work on fulfilling their probably unmet needs of love and belonging, esteem, and self-actualization. Some health outcomes in terms of hierarchy needs. So unmet safety needs can be physical and psychological. Violated physical safety may result in physical injuries, like we talked about previously. Unmet psychological needs can result in negative behaviors such as substance abuse, eating disorders, suicidal tendencies, PTSD, depression, and anxiety. Communicable diseases and infections are definitely applicable to this population. Survivors of sexual violence are definitely at risk for getting an STD from the assault. Generally, these patients have pretty poor follow-up tendencies, so the standard of care is to give them post-exposure prophylactic treatment. For example, if they present to an ER or something for a SANE exam, that's when they would be treated, rather than testing them for the infections, waiting for results, and then contacting the patient again for treatment if they need it. So typically antimicrobials will be used for chlamydia, gonorrhea, and trichomonas. Emergency contraception is given to prevent unwanted pregnancies. Sometimes hepatitis B and HPV vaccinations will be considered if the patient hasn't already received them and it's determined that they may have a significant risk for this exposure. HIV post-exposure prophylaxis is considered on an individual basis. Follow-up care is a very big component to the HIV and PEP. So, and as well as their risk factors for this. So, non-communicable diseases and infections for this population. So they can be at risk for some physical conditions such as chronic reproductive, cardiovascular, and sexual health problems, traumatic injuries, bruising, genital injuries, or just external injuries, asthma, irritable bowel syndrome, headaches, chronic pain, difficulty sleeping, activity limitations. Some mental health conditions that they could be at risk for is PTSD, severe anxiety, substance abuse, depression, eating disorders, and unwanted pregnancy. Self-care and self-harm is a concern for this population. Survivors are more likely to have suicidal thoughts and engage in self-harm. They're also more likely to engage in negative health behaviors such as substance abuse, smoking, risky sexual activity, and poor coping mechanisms. Sexual violence can also really impact the survivor's ability to maintain their jobs. They often perform poorly when they go back to work, or they can't work, or they take a lot of time off from work. Some resources for these victims, in Utah specifically, there's a lot of kind of national helplines and stuff as well, but for Utah specifically, there's a 24-hour sexual violence crisis line. They can talk to advocates on this line, and they are actually, from wherever they're calling from, they will be routed to a local advocate to better help get them resources close to them. The Crime Victim Reparations Program assists victims with medical costs, mental health services, relocation assistance. So, for example, if a victim comes in for a SANE exam, we can give them kind of we can help get them connected with the reparations program to help get them this assistance. Locally in Moab, where I live, Seahaven Family Crisis and Resource Center is the local women and children's shelter, and they have victim advocates, crisis support. They help get victims set up with counseling. They have support groups, financial assistance, medical advocacy, and like I said, they're also an emergency shelter. And what I really love about this shelter is if they are full, they have the resources to help get victims accommodations elsewhere, which I haven't seen in kind of bigger cities. It seems like sometimes they have limited resources in that arena. Risk for harm by or to others. So definitely kind of the nature of sexual violence is someone is causing harm to the victim. So they're more likely to suffer. They also have an increased risk for additional acts of violence, including physical violence, re-victimization of sexual violence, intimate partner violence, and sex trafficking. They all have higher risks of kind of reoccurring violence. And as mentioned before, the sexual violence can lead to physical and psychological injuries. So how do we mitigate risk for harm by others for survivors of sexual assault is kind of prevention strategies to reduce sexual violence. A lot of these techniques include supporting social norms that protect against sexual violence and normalize safety and respect, teaching skills such as social emotional learning, safe dating, consent, relationship skills, healthy sexuality, promoting opportunities to empower women, develop protective environments in schools, workplaces, provide victim support, teach healthy conflict management, especially in families, promote emotional health and empathy, and promote academic achievement. All of those techniques have been shown to reduce sexual violence perpetration. And that's it. Thanks.